Hello, my name is Melissa Goodwin, and I'd like to thank you for joining my presentation on Oxycontin, a substance use. Oxycontin is a powerful opioid medication. It is used to treat persistent pain and pain following surgery. Oxycontin, a well brand of the potent painkiller oxycodone, is a semi-synthetic opioid that is used to treat moderate to severe pain. It is prescribed to a diverse group of people, including those with cancer and those who have other severe pain. It is taken orally and gradually dissolves into the circulation over the course of 12 hours when administered as directed. On the streets, Oxycontin is also known as Oxycontin, OC, and drugstore heroin. Oxycontin is for a review of oxycodone addiction. There are some recreational uses, some dependency, and then there you have some addiction. Recreation use, they may be taking it more than prescribed, looking to oxycodone for relief on bad days. And dependence, they might be experiencing withdrawal symptoms. They need more oxycodone to achieve that high. They may also have a craving, doing addiction. They start prioritizing oxycodone use above everything else. They might be endangering themselves and others, and they could be struggling financially because of the use of oxycodone. A widespread issue, addiction has an impact on a wide range of people, their families, and community. In 2014, 4.3 million Americans aged 12 and older reported taking prescription opioids non-medically, while roughly 435,000 said they were currently using heroin. Like diabetes or heart disease, addiction is a chronic illness for which there is no known cure. However, addiction may be controlled and addicts can and they do recover. So the abuse history with Oxycontin in 2019, about 10 million individuals abused a prescription painkiller. The abuse increased by 152% between 2004 and 2008. More than 35,000 people died as a result of the opioid addiction in 2010 alone. It is derived synthetically. The opioid is derived liquid opium poppy, and it does act on three major classes of opiate receptors: the mu, the kappa, the theta. So Oxycontin synthetically from large unrelated chemicals. Opiates are produced by either directly defining the opium poppy juice or by very minimal chemical alterations. Opioids and opiates both interact with the three primary classes of the opiate receptors that we discussed earlier, as well as numerous lesser classes, including neuroceptin and zeta. The mu receptors are believed to produce analgesia, respiratory suppression, bradycardia, physical dependency, gastrointestinal dysmotility, and euphoria, to greatly simplify matters. The kappa agonism can cause dysphoria, meiosis, and hallucinations. Although some have indicated that mu agonism is required for the delta receptor to act fully for analgesia, it is likely that the delta receptor has effects on mood and pain management. Brain dopamine levels are modulated by the nociceptin receptor, which also has therapeutic benefits, including analgesia and anoxiosis. And the zeta receptor, also known as the opioid growth factor receptor, has a limited number of roles in the regulation of pain or emotion, but may control some forms of cell proliferation, including skin and growths. The abuse history symptoms include sweating, drowsiness, slowed breathing, dry mouth, headaches, itching, constricted pupils, nausea, and vomiting. Strong and extremely addictive Oxycontin is. Oxycontin can be misused to the point of overdose. If Oxycontin is used in excess, it might harm the brain and permanently or make the respiratory system fail. When Oxycontin is used improperly, Oxycontin pills or capsules are frequently eaten, crushed, snorted, diluted, and injected or smoked in tinfoil. These methods bypass the time release function of the tablets and saturate the brain with medication. This activates neurotransmitters to provide a potent high or euphoric feeling that is comparable to what heroin or opium causes. Since 2010, Oxycontin has been produced as crushed and tamper-proof, tamper-resistant pills that cannot be snorted or injected. The medication can still be misused, though. The prevalence and epidemiology of Oxycontin. In the late 1990s, pharmaceutical companies denied addiction properties, which we found out that wasn't really true. So there became a widespread misuse of Oxycontin. The overdose rates increased between 2000 and 2014. And then in 2017, greater than 47,000 Americans died from Oxycontin abuse. 1.7 million people suffered from substance use disorder. In 2019, nearly 50,000 died from opioid-involved overdoses. So, as I stated, back in the 1990s, the pharmaceutical company said, oh, no one can get hooked on opioid painkillers. And then we found out that people can. And as a nurse that had previously worked in the ED, it was obvious that that was not true because we were bombarded by people that were asking for opioid prescriptions. Or Dilaudid is another drug of choice that they like that we can give IV that gives them a sudden high. So it was not true that people did not get addicted as evidenced by the opioid crisis that we are currently in. In 2014, over 28,000 overdose cases were caused by opioid use disorders, which affect over 2.5 million Americans. And then the neonatal abstinence syndrome and the spread of infectious disease like HIV and hepatitis, they are both associated with the use of opioids, including heroin and prescription painkillers. Um, there's often a tie between heroin and Oxycontin because it gives them a similar high. So either they would like to get the Oxycontin or they would like to get the heroin. It is abused by all ages. Um, they, as stated previously, they chew or they crush the tablets. Crushed tablets can be snorted, or it can be um, dissolved in some water and then they inject it. So 21 to 29% of patients prescribed opioids for chronic pain misuse them, and between 8 and 12% of people using opioid for chronic pain they develop an opioid use disorder, and 80% of people who use heroin first misused prescribed opioids. So the likelihood of developing opioid use disorder depends on many factors, including the length of time a person is prescribed to take opioids for acute pain and the length of time that people continue taking the opioids, whether as prescribed or they misuse them. Deaths from overdoses of opioids and opiates have substantially increased in the United States. Again, between 2000 and 2014. That was a pattern that had never been seen in history before. So then in 2010, many states in the United States enacted new regulations, either enhancing scrutiny of consumers or restricting prescribers of both. So that was a big thing back in 2010 because I can remember being a nurse and there were many prescribers in the area that I am currently in now, where they were strict of their license because people were going into the doctor's office and they were able to pretty much purchase prescriptions. So like hundreds of these pills were being written at a time because the providers were making a lot of money off of this cash offers. But they did crack down, and I know quite a few that lost their medical license for that very reason. So there are lots of vulnerable populations, again, ages 12 and above. And if we look at the statistics and the research now, they are having even more problems in the school systems because they are not able to handle this crisis with the young generation now at a very early age are now being addicted to the opioids, and they're easily getting their hands on it because they're on the streets. You know, some people don't even take their medications, they're selling them on the streets. All right, the effects of Oxycontin abuse. There are some short-term and long-term effects. Short-term, it acts on the opioid receptor in the brain and throughout the body. It decreased the GBA activity. There's an upswing in the release of dopamine. So after feeling this dopamine rush, a person could do everything to have the same sensation all over again. So then that's when we have this whole thing about they're selling things they may be stealing. They're using up all of their money to get these opioids. They may not be paying their bills. So long-term effects are severe constipation, persistent vomiting, muscle spasms, slow heart and lungs. If injection can cause if injected, it can cause a blockage infection or maybe a widespread infection. Um, so there are some not good effects from abusing Oxycontin. So we need to keep a lookout for those things. So some signs and symptoms of abuse. So if we look at behavior symptoms, they may be doctor shopping, they may be stealing, they may be mixing Oxycontin with other drugs, they may be telling a whole lot of lies to get a hold of what they want. Physical symptoms, they might keep this runny nose, watery eyes, they may stay constipated, itchiness, disrupted sleep patterns, they're not sleeping good, impaired motor skills, they may persuasive lethargy or fatigue, powerful cravings for Oxycontin. And those people are addicted. It's just a terrible craving for them. Physical pain and flu-like symptoms when unable to use Oxycontin. Mental symptoms include poor focus and concentration. They have a loss of interest. They have diminished motivation. They'll have these mood swings. They'll be very anxious and have a lot of agitation. These, you would call them to be very moody people when they do not have that drug on board in their system to keep up with that high that they're craving. Potential overdose. It does link to a lot of overdose deaths. Is linked between suicide and drug use. They really can't define whether the person was really trying to commit suicide or was it the drug use and drug abuse. So the overdose involving opioids and sedatives were responsible for 39% of the reported desire to die. So this is a drug of choice if people want to commit an overdose. Prescription opioid use disorder is two times as likely. They are two times as likely to commit suicide because at that point they may be so far involved in it with the telling all of the lies and the stealing, using up their money. Their life might be spiraling out of control. So then there's a lot of hopelessness, helplessness, with everything that links up with suicide. So there, as stated, there are people that actually that's what they use, that as a drug of choice. And I would say even doing my rotation so far, some people say, well, I'll just take the pills that I have. So it may not be necessarily Oxycontin, but pills is a substance for those who desire to commit suicide. So the patients that abuse Oxycontin, pharmacological wise, they could be given methadone or buprenorphine because it decreases withdrawal symptoms and cravings. There is a drug with buprenorphine and naloxone, and as we know, naloxone treats opioid overdose. I will tell you at the facility that I currently work at, all opioids that are dispensed with naloxone, or it is confirmed that they already have naloxone at home that have not expired and they have not used it. So therefore, we always replace the naloxone because we do not want to have opioid overdoses. They are instructed how to use the naloxone. Family members, if need be, that how do you use the nasal spray. Medications need to be kept at home and secured in a secure location, because this is a drug that we definitely will not like to have children get a hold of. Women should disclose to their doctor whether they're expecting or nursing a baby. Remember, people that are addicted to Oxycontin and other opioids, they don't really care if they're pregnant or not. They have those cravings and they really want that medication. Patients using these medications shouldn't utilize illicit substances or other opioids. They shouldn't consume alcohol, and they shouldn't use sedatives, tranquilizers, or other brief than medications, because the respiratory system is already impaired with the use of opioid medications. I will tell you from my experience in the ED, anytime that I gave any IV opioids, I've always put my patients on a monitor to make sure that they did not have a negative effect for the respiratory system decrease. And I actually did have a few patients that their respiratory suppressed enough where I had to put some oxygen on them. Non-pharmacological uses, behavioral health counseling, they need to attend that regularly. So for patient educations, we're going to make sure that they're committed to their treatment, that they know the risks of relapse and other concerns. They keep all of their appointments. They're taking their medications as prescribed. Only use drugs that they are prescribed. Allow and encouraging involvement from their families and friends if they want them in a part of their care. We want to try to help to avoid relapse. So we want to tell them to stay away from the people, places, and circumstances that started them with the drugs in the first place, and we want them to stay away from alcohol, because we do not want them to mix alcohol with those opioids. They may need to be referred to pain management, and they may also need inpatient or residential treatment facility. So they need to follow up with their counseling. They might need cognitive behavior therapy. They can use motivational enhancement, group therapy, family counseling. It depends on what has been involved to lead them to the circumstances that they currently would be standing in. So, in conclusion, with approximately 64,000 overdose deaths in 2016, the United States is currently experiencing the deadliest drug crisis in its history. Pain alleviation is a typical cause for people to seek medical attention. In 2016, 11.5 Americans used prescription narcotics recreationally, and 46,802 Americans died from opioid overdoses in 2018, including those caused by prescription opioids. A thorough patient assessment, short and long-term treatment planning, attentive follow-up, and ongoing monitoring are all necessary for prescription opioids appropriateness. Thank you for listening to my presentation. My references, there are lots of references out there. There are a lot of things that we can do as providers to continually to educate family, friends, and patients to try to have a safer society and not put drugs in people's hands that may not be mentally stable, and they use this as a method to end their lives. Thank you and have a great day.